Acid reflux is more than an uncomfortable condition. It can actually increase your risk for esophageal cancer. The Iowa Clinic's Dr. Justin Rice explains Barrett's esophagus and its treatment.
So Barrett's esophagus is a change of the lining of the esophagus. We think it comes from long-standing acid reflux, and it increases the chances of getting esophageal cancer. That risk is relatively low, but it is a real risk of turning into cancer in the long run. Traditionally, the way that we've dealt with Barrett's esophagus in the past is just having repeat endoscopy every so many years. Currently, the guidelines are repeating an endoscopy every 3 years if there's no evidence of dysplasia, and hoping to catch cancer sooner, but that doesn't always work, and that's one of the problems with the current plan, is that people develop cancer in the interval between endoscopies. A newer technology called radiofrequency ablation. It's been out for more than 5 years now, but it's really just become more of the standard of care recently. And it is an ablative technique that a balloon catheter expands in the esophagus and it burns the tissue of the esophagus, and then the body heals in normal, healthy tissue instead of this changed lining of the so-called Barrett's esophagus. Radiofrequency ablation of these lesions is much better tolerated by the patients. It's done as an outpatient procedure, and patients tolerate it much better. They do have to come back for a few more sessions, however. So on average, in the studies that have been published, people need between 2 and 3 treatments to completely eradicate the Barrett's esophagus.
For more information on Barrett's esophagus and its treatment, contact the Iowa Clinic Gastroenterology Department at 515-875-9115.